James. We're very professional here. You know, there is no textbook right answer, but as you will see after some time, and this is what I have said in the many Facebook lives, even 20 years from now, I would not have done your surgery any differently. Now, how and what went through your process, having been in the medical field, that out of the 5 surgeons, you ended up choosing me?
The other surgeons, none of them was willing to do an en bloc capsulectomy. None. Three of the surgeons would not take my implant out without getting a new set. The other two, the one wanted to go back through my original incision, which was at my areola, and I did not feel that he would be able to get the full capsule out, even though he told me he would be able to. I said no, thank you. And then the other surgeon, he was said he would take the capsulectomy out, and take the capsule, everything out, but he was not willing to show me pictures or video to make sure that it was done correctly. So I did not feel comfortable with any of those surgeons saying they had to put the implants back in because of body image and all of that. I was at the point where I was not ready. I wanted them out. I had so many symptoms, and I need to be here and be healthy. And for them to say that you have to get another set back in and just get saline, they're safe. I'm like, no. So
You know, there's a lot of information. Again, if I can expand, saline implants cost the same hurt as silicone. So if I have 1,000 patients with saline implants come in and 1,000 with silicone, I cannot tell from their complaints if they have saline or silicone. They certainly can be interchangeable, meaning the same set of complaints that the patients have. Now, I will tell you, unfortunately, in today's world and age, you will look at, there will be a lot, if not all the surgeons have on their webpage breast implant unless explant surgeon, explant specialist, and you will see, unfortunately, they're still putting in implants. And I will tell you, no one with their true right frame of mind would be putting an implant and at the same time taking them out genuinely. It's a surgery about being honest and sincere and professional and truly committed to explant. And this is where, if your surgeon is putting them in, he truly or she truly does not believe in breast implant unless. Period. Case closed. The second thing I want to highlight, what you mentioned is so strong. You have to commit and confirm and even have it on the consent that you must and will not only get pictures but high definition videos of the chest wall showing complete removal of the capsule plus that implant sincerely, definitively, so that you have that bond with that surgeon. And it is a medical legal bond on paper that you must get the videos of the chest wall showing complete removal of the capsule. I will tell you, I'm just looking at a case from the Netherlands. I have a consult that I'm going to do in the next day where a lady has posted and she shared the pictures with me, and I look at her chest wall. I am not convinced that the entire capsule was removed, just looking at the pictures, because that is ultimately the proof in the pudding, if you will, where you have physical, direct, high definition evidence of the pictures and videos showing complete removal of the capsule, let alone the surgeon's track record and the presence on the web and their recognition and their what's the word to use, their the surgeon after some time will get that recognition on Facebook that they are genuine. And this is where ultimately the pictures, high definition pictures and videos, must be shared with the patient to show and confirm that all of the capsule was removed. And number two, the cutting open of the capsule on the table is also very much key, so that there is a high definition video of the surgeon cutting open using sterile gloves, because this is important. Sometimes there is a biofilm and you want to get a culture of the biofilm in between the capsule and the implant. So it should be done with sterile gloves, not like regular gloves which are non-sterile that I see some of the surgeons using, so that you get good representative cultures for aerobic, anaerobic, and fungal of the surgeon cutting open of the capsules on the table and sending it off to micro. So that is very important what you mentioned. And you have done your homework, your sixth sense. Sometimes it's good to take a significant other, a husband or a best friend, so that they will learn two minds are better than one, so you can ask the questions very appropriately and talk to the surgeon directly. You do not have to talk to the PA or the medical assistant or the fellow or the resident, talk to the surgeon directly. He or she must be involved from the beginning to the end. As you will see, most of my patients that come, I spend half an hour, 45 minutes with them, because this is where I myself, I am involved from the beginning to the very end when it comes to making sure everything is done right. This week I did, for example, 6 cases, and all 6 cases, I start to finish, I macro and micromanaged each one of them, every page, every clearance, every phone consultation, especially if they're out of town, and even post-op management is done by me. So that is very critical. And you want to feel comfortable with your surgeon. That is the most important part. So you narrowed it down, like you mentioned. Now, what this was a big deal for you. You were mentally prepared, physically prepared, and I must mention and highlight, you're only 37. So you got your implants, I was looking at your chart, in 2008, correct? This is your one and only set silicone. And if I'm not mistaken, there are 480 cc's below the muscle. Now, let me ask you this. Both of your implants, as I'm looking at the chart, were ruptured, correct?
Right.
Now, did you know going into the case that both the implants were ruptured? No, so this was a surprise. So another important point to make here is the surgeon must assume that both of them, all implants are ruptured till proven otherwise. Even the saline implants, which we know, I did a case yesterday where the saline implant was ruptured on the left side and the right side was intact, because saline implants are like water balloon. When they leak completely and they flatten just like an empty IV bag. Silicone implants, you could poke them 10 times with a needle, they will still retain their shape. So the surgeon always has to assume that the implants are ruptured till proven otherwise, because you do not want to find out during the case. So what you mentioned, very important, that the surgeon was going to go through the nipple areola. There is no way that a surgeon can do an end block from dissecting top down, dissecting below the muscle directly on top of the rib through the nipple areola. Impossible, virtually impossible in any hands. From my experience as a board certified surgeon, the best approach is to go with the inframemory crease incision, a horizontal incision that goes right in the crease, so the incision hides in the crease, and that way you can get access to the entire chest rib area, so that the surgeon can remove the entire implant capsule, all inflamed tissue. And remember, that entails removing the fascia of the pectoralis minor, the periosteum, perichondrium, the fascia of the intercostal muscle, and the fascia of the serratus anterior. So that complete total capsule removal, along with all inflamed tissue and implant, is done. Now, let me ask you this. What were your symptoms before that led you to explant?
Anxiety, depression, suicidal thoughts, GI upset from constipation, diarrhea, acid reflux, memory fog, headaches, joint pain, severe fatigue, trouble with sleep, pretty much everything on the DII checklist, I think, besides 2. And I'm 6 weeks out, and everything has resolved besides the body odor, which is part of the detox process. That is the only symptom, and a little bit of fatigue, but I'm still in the recovery phase. Everything else has resolved. I have not needed any medication.
Right. And I'll tell you, the heal is real. And this is, yeah, and this is where you have the end block was done, the right and left. We actually did a Facebook Live that day on the 8th. So if those patients are interested, you can go back and specifically look at the Facebook Live that was done on the 8th of January of 2025. So you can see firsthand exactly how the surgery went that day and how the implants were removed. And I like to do the Facebook Lives so you can see firsthand, and you can be right in the operating room to see. Now, this is really very consistent with what is reported in the medical literature as well, where you have resolution of signs, symptoms of what is breast implant illness. Now, I want to go ahead and highlight, this is the Mentor advertisement. You had Allergan implants, but this is a Mentor advertisement, and as you will see, Patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Quote unquote. Now I'm going to stop here. There are many surgeons who say breast implant illness does not exist. Guess what? The manufacturer here is saying that it does exist. So this is clearly evident that it does exist. Your words are clear evidence that breast implant illness does exist. We hear many surgeons saying it's a myth. I use the word, what a shame that the doctors are not listening to the patients. And this is the problem. The problem here is the doctors are not listening to the patients. And this is wrong because you have to listen to the patient's complaints. And they're, especially when the manufacturer is telling you these are the complaints. So I'm going to go ahead and quote individual patient risk for developing these symptoms has not been well established. Period. Some patients report complete resolution of symptoms when the implants are removed without replacement. Close quote. So in your case, look, you said that you just have that fatigue, but you have resolution of those symptoms. This is consistent with what the manufacturers have mentioned. Now remember, what's interesting about you is you had both ruptured, both were below, and you have in just this matter of from 8th till now, so you're looking at almost 23 days in January and now 21 days. So you have 44 days of recovery. Your surgery was 44 days out, and I just discharged you literally from my clinic, and I said what could be a better person to talk to. Now you got the same surgery that I did yesterday on the nice lady with the ruptured saline implant. I did the same surgery on you that I did a couple of days ago at the hospital where I operated on a 85-year-old lady, and she had 750cc implant that she had just gotten in 2019, and she got the same surgery you did and the same surgery that I've done every day of the week this year, this past year, 2 years, and everyone gets the same surgery. I don't compromise my surgery because of the patient's age, because of the patient's comorbidities. I just saw a patient off who came to me from Overland, Kansas, Overland Park in Kansas. And she was on Enbrel and immunomodulator. She got the same surgery that you did, and everyone gets. So there is no like, well, it depends, and I will see how thin or thick the capsule is, how involved it is. No matter what length of time, every patient gets the same surgery that everyone deserves. So that once your surgery is done, let's say today, for example, you have that number one absolute confidence that number one, your surgeon got all of it out, the implant capsule, and number two, that all of it was tested as well for what is the lymphoma, that very rare or rare lymphoma, that breast cancer or whatever abnormal pathology, and that you have peace of mind and tranquility that all of it was removed and all of it was tested, and that in the years ahead you have no surprises awaiting you. Now I want to go ahead and also mention that your pathology report, and I'm reading the report itself, says that you had the right breast implant capsule, histiocytic and multinucleated giant cell reaction to non-polarizable material consistent with silica, and the same thing on the left side. So if anyone says, why do you remove the capsule? There is silica within the capsule. If that capsule is left behind, the body will continue to hurt and harm and basically be affected negatively as a result of that silica, and that will continue to have the patient will continue to have the many symptoms of what is breast implant illness. Now let me ask you this, you kind of mentioned this early on. How was your anesthesia experience?
The nurse anesthetist was amazing from the time she came in and introduced herself to talking about the process. And this, of course, being in the medical field, I was afraid of like aspiration and things like that. She was just amazing, making sure I felt comfortable with, getting put to sleep and going through anesthesia. Post-op, I usually get super sick. I had very minimal nausea. I had went back to the room and was super comfortable, needed zero narcotic, hydrocodone. It was just amazing. She was so informative and made me feel very comfortable, and I had no post-op anesthesia.
No, thank you very much for that feedback. It's important. Remember, we do the IV general, which is the twilight deep sedation. To date, not a single patient has had any recollection of the surgery. It is essentially the propofol, fentanyl, Versed. The patients are not paralyzed. We do not have a ventilator breathing for the patient. And this is where we want to do very effective practical anesthesia where the patient has very good control, post-op where they have minimal side effects. I do not like to do the general unless absolutely required, but we have to go through the different practical, less anesthesia, because we always have the next level up to go to. Now, let me ask you this. If someone who's listening, there's many doctors who say that this whole breast implant illness is a myth, that this is all in your head, that you just came here to Michigan and you had Michigan water that made you feel better, or you had whatever experience post-op and this is all in your head. What would you say to them that this is, like you imagining your recovery, or this is a placebo effect?
This is definitely not placebo. I know from my sixth sense, my gut feeling, this is just the beginning of feeling so much better. The reason originally that I started this process, I had found an actual lump in my breast. I have a grandmother that had breast cancer. I went to a surgeon locally 2 years ago and he wanted to do a lumpectomy, and I decided no, he would not do a needle biopsy because of my implants. So honestly, it took me 2 years to talk myself into seeing what was in my breast because I wasn't sure, and trying to figure out the logistics of work and family and things like that. But ultimately, the II is real. The surgery recovery, honestly, has been very easy. I have a supportive family, but the II is real and the heal is real. It's 6 weeks. They're amazing how I feel. And I just tell everybody, love what God gave you.
Right. And I will tell you the hundreds of thousands of ladies who have benefited from the explant, and they have voiced similar stories. That's real. The before and after pictures of the ladies' faces and their eyes with their inflammation gone, that is real. The fact that the implants were banned in 1992, that is real. And you will see patient after patient. This line right here that they have complete resolution of their symptoms, this is real. So anyone who says it's a myth, unfortunately needs to understand, and they need to open up, and they need to be very they need to listen to the patients, and this is the whole purpose of this Facebook Live. So your words against theirs, and I'll tell you anytime your words carry a whole lot of meaning, because you have no purpose but to get healthy and better. And the other surgeons, unfortunately, who still to this day do not want to accept it as a reality, their priority is different and is financial, unfortunately. Now, what would you, let me ask you another question. The, the, how was your travel experience? Because I know you drove. How, as far as how did you prepare for your trip? Like, where did you stay? A lot of patients ask, it is a big deal for me to kind of leave Virginia, or I have to travel from California. I have, just so that you know, a call to Hawaii after this, a call to the Netherlands, call to Berlin, Germany, and literally all the neighboring states. And the point here is, a lot of my patients, 9 out of 10, travel, and it is very safe to travel, be it by car, or be it by plane. Now, how was your travel experience?
Traveling in was fine. We just prepared and made sure we had lots of healthy foods and things for us to stay at the hotel. The hotel we stayed at was part of a timeshare that we're a member of. It was not the best, but we made the best of it. And on the way home, I was very concerned about the long car ride, but I was so comfortable. We got out and walked every hour, hour and a half, maybe two at the most, and stopped and walked, and it went flawless. My husband is an awesome traveler, though, and driver and things like that. feel super comfortable. But I was so comfortable. I had surgery on Wednesday, and Friday we drove 7.5, 8.5 hours home, and I was comfortable.
Right. No, very good. So I want to mention there's concern, about the DVT, for example. Every patient wears the compression socks. Every patient gets heparin 5000 subcutaneous right before anesthesia. Number three, every patient on the day of the surgery is out of bed to the chair. The next day, every patient is required to walk. Number five, everyone gets the sequential compression device boots on the operating room table. And number six, very importantly, no one is paralyzed. Everyone has that twilight deep sedation where now there is no pooling of blood in the leg. And again, overall, relatively speaking, this is a short surgery. In a sense, it's, plus minus 4 hours. It's not like the 6, 10, 12, 14-hour surgeries that we hear of at times, like the deep flap, for example. So this surgery is plus minus 4 hours and overall well tolerated. I like what you mentioned that every hour, hour and a half, you're taking a break, which anyone should do. Let's say if someone's driving from here to Cleveland, which is 3 hours away, you should take a break in the middle. You should always take a break an hour and a half just to stretch. It is always good for the neck, back, and certainly even if you're on the plane, every hour and a half or two, you should be getting up and walking about to prevent the DVT. So with all these precautionary measures, so that 85-year-old lady that I did a couple of days ago, very nice lady, she was on Eliquis, and I operated on her. And her cardiologist basically said that she could come off of it for 2 days prior to her surgery, and I made sure she basically resumed it on the day of the surgery. The Eliquis is a blood thinner, given her underlying heart condition, and I can still operate very safely. And this is where I coordinate with your primary care doctor, or if you have a cardiologist, if you have cardiac issues, that the surgery absolutely can be done very safely, very definitively, and in a lot of control, where we go into the surgery with confidence. If those patients are under aspirin, for example, because of a couple of weeks ago, I took care of two patients actually that had iliac stents, and I made sure that they would be back on the aspirin so that their blood is thin enough so that they don't have any clotting issues with their underlying stents. Now, the other thing I want to mention here is, I returned the implants to the patient last week. I did take care of 3 ladies, one on Tuesday, one on Wednesday, one on Thursday, and each one of them had said that they have saline implants. And believe it or not, each one of those ladies on Tuesday, one on Wednesday and Thursday, they had silicone implants, and that's why returning the implants to the patients is also very much key. Now, we will go ahead and start wrapping it up. I just want to go ahead and mention this to the many patients. Do your homework, do it right, do it once. I have a phone consult with a lady who was already explanted, and now it's residual capsules, and I'll tell you, what a shame that she has to go through the surgery again. In my practice, you want to have that complete peace of mind that entire implant capsule and all that inflamed tissue is removed completely, sincerely, definitively, the first time. And this is a surgery where the insurance is not going to cover. This is, unfortunately, the ICD-10 code is not, given. The insurance companies do not want to recognize this. The reimbursement rate is basically very shabby, and no surgeon can float a practice where they're doing the entire implant capsule removal and the insurances are paying the surgeon for their time, because that will be a chapter 11 waiting to happen. As you will see, the insurance companies do not care about the patient. Unfortunately, that is a hard reality. You will see as the insurances, we heard about, for example, with anesthesia, the insurances did not want to cover but that 1 hour. If it was going to be more, that they were going to pass the burden onto the patient to cover the anesthesia services. If you look under Blue Cross Blue Shield 3 months ago, they floated this idea, which was shot down. But look, last night, we hear Medicare is not going to reimburse telehealth anymore after a period of time, which is a major change, if you will, for the worse for some of the elderly patients that cannot travel for their telehealth conference, a telehealth medical visit. Now, the bottom line here is you want to do your homework, do it right, do it once. You want to do your complete analysis. I like what you said. You sought 5 consultations. And you want to get that confirmation in writing that you will get the pictures and high definition videos of the not only the chest wall showing complete removal of the capsule, but cutting open of the implant and capsule on the table. This is not a HIPAA violation. This is very much consistent with the fact that you have to have that proof all of that capsule and inflamed tissue was indeed removed in the manner as was discussed. Talk to the previous patients, like you said. Listen for 1 year if you have to. I've had a patient that listened for 5 years before she made up her mind because she was saving the money and she had a child. It was COVID. And then ultimately she came, do it right, do it once. And you want to have that peace of mind and tranquility that all what was removed definitively with honesty and sincerity, and that all of it was tested. Now, if you could please have some words of wisdom as you please wrap it up.
Yes, if anybody has any questions or concerns about the process or anything that I had went through, please reach out to me. I'm telling you, the heal is real, and I know it's a whole adjustment and thought process to have a surgery with the restrictions that's required to recover, especially being as busy and hardworking as I am myself. But I'm telling you, it is worth it. Do not live the next however many years of life feeling like I was when you can have your life back after surgery.
Right. No, thank you. Thank you. Those are very strong words. We look forward to another Facebook Live. Thank you very much for sharing your journey. We will love to hear from you a year out. Remember, it takes some time to get here. Your implants were from 08. 16-year-old set of implants, Allergan 480cc below the muscle. It will take you some time to recover, and you're already showing that significant improvement. I get this question asked, and I'll end with this. How many of my patients have sought improvement, recovery? And I'll tell you, well over 90% of the patients have improved. And remember, most of this feedback is anecdotal and right after the surgery, and it's not like a long-term result. One day I will have like a year-long follow-up with my patients so that we can publish this, so that we will have hard evidence from the patients, so that the system will recognize. You go to a lot of primary care doctors and they're like, what are you talking about? Implants are safe. These are, if you ask me about high blood pressure, I will say I have no idea. If you ask me about diabetes management, I have no idea. If I ask what you do as a nurse practitioner, I will have no idea, because I am not a rheumatologist or an internal medicine doctor. Likewise, if you were to ask a primary care doctor what is breast implant illness, they will have no idea. They would probably have never even touched the implant. And they certainly cannot weigh in on what is a very serious and important topic. And unfortunately, history is repeating itself. But there is certainly a momentum across the country and across the world. There's another international summit happening in March between the Netherlands and, there are a lot of discussions that are happening, and we will certainly be raising a lot more awareness. Thank you very much for your time. And I'll end. Please say one final word and we're done.
The heal is real, and thank you so much for giving me my life back.
Thank you. Thank you very much. I appreciate you coming on and sharing your journey. Thank you.
Thank you.
Take care. Bye-bye.